Greetings and welcome to today's Innovations in Facial Plastic Surgery update. Today we will be talking about blepharoplasty. Blepharoplasty refers to any operation for the correction of a defect in the eyelids. It can refer to either upper or lower eyelid blepharoplasty. Today we will mainly focus on lower eyelid blepharoplasty. There are several approaches to lower eyelid blepharoplasty. The first, the transconjunctival approach, involves making an incision on the inside of the eyelid, which is not visible at the end of surgery. The subciliary approach involves making an incision just below the eyelash line, which, when healed, is barely perceptible. Through the subciliary approach, a skin muscle flap may be developed. This type of approach decreases the chance of pull down of the lower eyelid. Through either the transconjunctival or subciliary approaches, fat must be either removed or repositioned. The bags which form under the lower eyelid are a result of fat protruding out from underneath the eyeball. If this fat is removed, it can result in a long-term hollowing of the eyelids. Repositioning the fat by moving it from bulging areas onto a more natural contour of the cheek does not produce this long-term hollowing. Hollowing does not occur in all patients. What question should you ask your surgeon during your preoperative consultation? While this is not a complete list, it should get you thinking about what to ask. What approach do you use? This is important to know if there are going to be scars on the outside of the skin. What is my recovery time? While every patient is different and no surgeon can guarantee a recovery time, different approaches produce different amounts of bruising and swelling, and a surgeon who has experience should be able to give you an approximate length of time before you can return to normal activities. What are the risks of surgery? Any surgical procedure has risks involved. It is very important to talk with your surgeon about the risks and benefits of surgery and determine if it is something that you wish to do. Will this fix the dark circles? This is a common question. Sometimes the dark circles under the eyes are caused by shadows formed by the protruding fat. At other times, the dark circles are actually pigment in the eyes. These are addressed in two different ways, and it is important to address this with your surgeon. The bottom line is, make sure to research the surgeon who is doing your procedure, research the procedure itself, and discuss your expectations with your surgeon. If the surgeon does not feel he can meet your expectations, then a second opinion may be in order, or it may not be advisable to proceed with the surgery. This is Dr. DJ Verrett for Innovations in Facial Plastic Surgery. Please visit us on the web, www.innovationsfps.com.